Have you ever wondered what your prostate does and why it needs so much attention as you get older? Men need to pay special attention to this small but important organ, especially after turning 50. The prostate is about the size of a walnut and sits just below the bladder. It makes some of the fluid that helps sperm move during sex. As men age, this organ can run into problems, and one of the most serious is prostate cancer. The good news is that when found early, prostate cancer can often be treated successfully. That's why knowing the warning signs is so important for men over 50. Let's start with something many men don't know. Prostate cancer often shows no signs in its early stages. This is why regular checkups with your doctor are so important. But sometimes there are signs that something might be wrong, and knowing these signs could save your life. The first sign to watch for is changes in how you pee. Maybe you're going to the bathroom more often, especially at night. Or perhaps you have trouble starting to pee, or the flow is weaker than it used to be. These changes don't always mean cancer. They could be caused by other prostate problems that aren't cancer, but they're worth getting checked out. Another sign is if it hurts or burns when you pee. This feeling might come and go, or it might stay around for a while. Again, this could be caused by several things like an infection, but it's important to have a doctor look at it, especially if it doesn't go away after a few days. A third sign that needs attention is if you see blood in your pee or semen. This can be scary to see, and while it doesn't always mean cancer, it's something that needs to be checked right away. Sometimes this happens because of an infection or injury, but it's better to be safe and have a doctor check it out. Remember, these signs don't automatically mean you have cancer. Many times they're caused by less serious problems that can be easily treated. The key is not to ignore them. Think of these signs like warning lights on your car's dashboard. They're telling you to get things checked out before they become bigger problems. In my experience talking with men about these issues, many say they wish they'd paid attention to these signs sooner. Being aware of changes in your body and acting on them is not being overly worried. It's being smart about your health. The fourth warning sign to watch for is pain in your lower back, hips, or upper legs that doesn't go away. This kind of pain might show up when cancer has spread beyond the prostate. But don't panic. Back pain is very common and can come from many other things like muscle strain or bone problems. Still, if you have pain that stays around for more than a few weeks, it's worth talking to your doctor about it. Number 5 on our list is trouble getting or keeping an erection. Have you noticed changes in your sexual function? While this is common as men get older, sudden changes in your ability to have an erection might mean something needs attention. This could be linked to prostate problems, including cancer, but it could also be caused by other health issues like heart disease or diabetes. The sixth sign to look out for is unexplained weight loss or feeling very tired all the time. If you're losing weight without trying or feel exhausted even after a good night's sleep, your body might be telling you something. These feelings can be signs of many different health problems, and yes, sometimes they can be signs of cancer. Now, let's talk about what happens in your body when prostate cancer develops. The prostate cells start to grow in an unusual way. This growth can press on the tube that carries pee from your bladder, which explains why many men notice changes in their peeing habits first. As these cells keep growing, they can spread to nearby parts of the body, which is why some men might feel pain in their back or hips. What makes prostate cancer different from many other cancers is that it often grows very slowly. Some men can live with small amounts of prostate cancer for many years without it causing problems. In fact, some prostate cancers grow so slowly that they never need treatment. This is why doctors sometimes take a watch-and-wait approach with some prostate cancers, especially in older men. This information isn't meant to scare you. Instead, it's meant to help you understand what's normal and what might need checking. Many men avoid going to the doctor because they're worried about what might be found. But remember, finding problems early almost always makes them easier to treat. The earlier prostate cancer is found, the more options you have for treatment, and the better your chances are of beating it. Let's look at what helps lower your chances of getting prostate cancer. The good news is that there are several things you can do. First, eating the right foods makes a big difference. Foods rich in tomatoes, like pasta sauce and soup, contain something called lycopene that may help protect your prostate. Green vegetables like broccoli and cabbage also seem to help keep the prostate healthy. Adding fish to your meals 2 or 3 times a week is good too, because of the healthy fats they contain. Staying active is another way to help protect yourself. You don't need to run marathons, even a 30-minute walk each day can help. Regular exercise helps control weight and may lower inflammation in your body, which could help protect against cancer. Have you thought about adding a daily walk to your routine? Keeping a healthy weight is also important. Extra body fat can change how your hormones work, which might make prostate cancer more likely. Even losing a small amount of weight can help lower your risk. Some studies show that men who have more sex, including self-pleasure, might have a lower chance of getting prostate cancer. Scientists think this might be because it helps clear out old fluid from the prostate. However, more research is needed to know for sure how this works. Taking vitamin D might also help protect your prostate, especially if you don't get much sun. But before you start taking any vitamins, talk to your doctor about what's right for you. Too much of any vitamin can cause problems. Something interesting scientists have found is that drinking coffee might help protect against prostate cancer. But this doesn't mean you should start drinking lots of coffee if you don't already. The key is balance in everything you do. Here's something important. These healthy habits work best when you start them before any problems show up. Think of it like maintaining your car. It's better to take care of it regularly than to wait until something breaks down. But even if you do everything right, there's no sure way to prevent prostate cancer completely. That's why knowing the warning signs and getting regular checkups are so important. Many men feel nervous about prostate exams, but doctors do these checks all the time. It's a normal part of staying healthy as you get older. Remember that prostate cancer is not caused by having sex, getting hit in the groin, or using a laptop on your lap. These are old myths that science has proven wrong. The truth is, the main things that affect your chances of getting prostate cancer are your age, your family history, and your race. But while you can't change these things, you can take steps to keep your prostate as healthy as possible. Now let's clear up some wrong ideas about prostate cancer that many people still believe. First, having prostate problems doesn't mean you'll get prostate cancer. Many men get a condition called BAPH, benign prostatic hyperplasia, as they age. This makes the prostate bigger and can cause problems with peeing, but it's not cancer and doesn't lead to cancer. Some people think that prostate cancer only affects very old men. This isn't true. While it's more common in older men, it can happen at any age after 50. That's why it's important not to ignore warning signs just because you think you're too young. Hit that like button if you appreciate health advice. It helps us create more content you need. Another wrong idea is that if you have prostate cancer, you'll know it right away. The truth is, early prostate cancer often has no signs at all. That's why regular checkups are so important, even if you feel fine. Think about it. When was your last prostate checkup? Many men worry that prostate cancer treatment will always leave them unable to have sex or control their bladder. While these can be side effects of some treatments, there are many different treatment options now. Some have fewer side effects than others, and many men recover their function over time. Some people think that prostate cancer always needs treatment right away. Actually, some prostate cancers grow so slowly that they might never cause problems. In these cases, doctors might suggest watching the cancer carefully instead of treating it right away. This is called active surveillance. There's also a wrong idea that supplements alone can prevent or cure prostate cancer. While some supplements might help keep your prostate healthy, none of them can prevent or cure cancer by themselves. Always talk to your doctor before taking any supplements. Some men believe that having a high PSA, prostate-specific antigen test result, always means cancer. This isn't true. Many things can make your PSA level go up, including infections, recent exercise, or even some medications. That's why doctors often do more tests if your PSA is high. Another myth is that prostate cancer runs in every family. While having family members with prostate cancer does increase your risk, most men who get prostate cancer don't have it in their family. This means you should still be careful about warning signs even if no one in your family has had it. Some people think that prostate cancer is always deadly. The truth is, when found early, prostate cancer is one of the most treatable types of cancer. Many men with prostate cancer live long, full lives, especially when it's found before it spreads to other parts of the body. Let's talk about when you should act right away and see a doctor. If you notice blood in your pee or semen, don't wait. Call your doctor as soon as possible. The same goes for new pain in your lower back or hips that doesn't go away, especially if it keeps you up at night. If you're having a lot of trouble peeing, feeling like you need to pee all the time, or if it burns when you pee, these also need checking. While they might not be cancer, waiting too long could let a small problem become a big one. Sudden changes in how well you can get or keep an erection should also be checked out. Your doctor needs to know about any changes in your sexual function, even if it's embarrassing to talk about. Remember, doctors deal with these issues every day. It's normal to them. Weight loss you can't explain or feeling very tired all the time are also good reasons to see your doctor. These could be signs of many different health problems that need attention. What should you expect at the doctor's office? First, they'll ask about your symptoms and how long you've had them. They'll also ask about your family's health history. The doctor will do a physical exam, including checking your prostate. This exam takes only a few minutes and can tell the doctor a lot about your prostate health. Your doctor might also do a blood test called PSA to check your prostate. Based on these results, they might want to do more tests, like an ultrasound or a biopsy. Don't let fear of these tests keep you from getting checked. They're much easier to handle than dealing with cancer that's found too late. Taking care of your prostate is just one part of staying healthy as you get older. Keep eating healthy foods, stay active, and get enough sleep. If you smoke, ask your doctor for help quitting. These healthy habits help your whole body, not just your prostate. Remember, you're not alone in dealing with prostate health. Talk to your doctor about setting up regular checkups. Share what you've learned with other men in your life. They might need this information too. The most important thing is to pay attention to your body and act when something doesn't feel right. Many men are living healthy lives after prostate cancer because they caught it early. You can protect yourself by knowing the warning signs and getting help when you need it. Thanks for watching. Let us know your thoughts in the comments. Your feedback helps us create better content. See you next time.